I'm Christine Topham. I'm 64 years old, and I live in Cartersville, Georgia. Well, I found out about Biote through a fellow realtor. We were at a luncheon, and I started noticing how wonderful she looked. She'd lost some weight recently and was full of energy, so I asked her what was her secret, and she said that it was the Biote hormones and led me in the direction of the nearest clinic. Well, when I think about prior to taking Biote, I remember just being so tired all the time, also anxious, and I suffered from a little bit of depression, and I had no libido whatsoever. It was a drag because the hot flashes were keeping me up at night, and it was just kind of difficult to get through the entire day. Well, Biote hormones have increased my energy tremendously. I also feel better as far as physically. I have a very strong sex drive now. My clarity in my mind is much better. I don't need as much sleep. I just feel like I'm in my 40s again. I tell everyone that I know. I share that information. I literally would like to stand on top of a mountaintop and just scream out, you don't have to suffer anymore. You can have a great life. You can feel better again. You can have a great life with your husband or whoever you're with, both on the intimate level, but also on the energy level.
So what is this Biote method? What is Biote? So Biote looks at hormones. It looks at hormones in a very advanced way. It's looking at hormones in a way that individualized therapy to you specifically as the patient. So it's looking at testosterone, estrogen in females as well. Sometimes it's looking at progesterone. What about thyroid? We've all heard about thyroid. Thyroid controls a lot of things in the body. So sometimes as we age, our thyroid isn't optimized. So your provider at Biote has been trained in advanced ways of interpreting labs and giving you options on how to fix that thyroid. What about the idea of supplements, right? There's certain micronutrients like vitamin D, probiotics, and all these things that are really important to your health. So your provider's also gone through some advanced training to help you understand which particular nutrients you need to take more of and which maybe you don't. All of those things go into making the Biote method what it is. And that whole method is really based off years and years and years of clinical experience among several different providers. And so all of that together leads to our ability to be able to support you the best way we know how to.
You just have that feeling as you're getting older that something's not right, and it's hard to put your finger on what that right is. To me, it's like you lose who you were, and you're trying to find that person, and no matter how hard you work out, no matter what you do, you just can't find that. And the key really is the pelleting. Even after the first round of pelleting, the change with mental fatigue, weight loss, focus, all those things, anxiety, sleep, everything gets better with pelleting, and you don't have to be on different drugs just chasing symptoms. For any of the males of my age that are doubters out there or have hesitancy about doing it, the procedure, it's like getting a shot when you go to the dentist, and after that, there's no pain. And I tell them, you know, it doesn't hurt. What you get out of it is so worth doing the procedure. And like I said, it's so minor that you don't even worry about it at all.
Today I'm going to talk to you about a compound called DIM, specifically DIM SGS+. DIM stands for diindolyl methane, and SGS+ is an extract from sulforaphane. And these are two very important components that help metabolize estrogen appropriately in the body. So when a patient has hormone issues, oftentimes those issues are from how those hormones are metabolized in the body. And so you can actually consume micronutrients that help facilitate the metabolism of those hormones out of the body. And so this particular product is first in class, first of its kind. And what it does is it helps hormones, both made in the body, but hormones taken outside of the body, to help them go through the body and act on the areas that it should to enhance the patient's health. So if you have any signs of hormone imbalances, Check out DIM SGS Plus today from Biote.
Do you have symptoms of hormone imbalance? If you're a woman and you notice that you've been more irritable than you were prior, maybe you're a little more anxious than you used to be, you feel like you have mood swings, you're developing night sweats, you're not sleeping as well as you used to, you're having hot flashes during the day or at night, you feel like your sex drive has decreased, or you have discomfort with sexual intercourse, these are all symptoms of hormone imbalance.
You know, we all at some point reach a season of our life where we say, I don't feel myself anymore. How come I'm tired all the time? And those symptoms in men might show up in the form of decreased libido or sex drive, decreased performance. We're gain weight in our midsection and we don't like that. We lose our muscles and we don't like that. Our strength is going down. We have reduced mental focus and concentration. We might experience anxiety or depression. We might get irritability as well. Perhaps we're having elevated blood pressure, blood sugar, cholesterol levels. Oftentimes these symptoms are rooted in hormonal imbalance. So it starts with a simple blood test. Ask your provider today how you can do that.
So since we've introduced Biote to our practice, I've seen a huge difference in patient care. Our patients noticing increase in mental focus, increase in mental clarity. They have more energy. I hear almost daily in my practice, patients thank us for giving them their life back. Husbands thank us for giving them their wife back. Their relationships have improved.
You know, they come to us maybe just to lose weight, but then they realize, like, even with the weight loss, they're still not feeling their best. We check their hormones, realize that they have an imbalance, and get them on the Biote program, and it's just like a life changer.
What Biote means for our practice is that it is a vehicle in which we can help get to the root cause of so many chronic diseases.
Being a Biote provider is one of the most satisfying procedures that I perform as a family medicine physician. There's very few interventions that I can offer patients where consistently people come back and say, I really feel better.
I've had patients who could barely get out of bed, chronic pain patients that have been transformed.
So I've pelleted over 24,000 patients since I started with Biote, and I can honestly say it really literally changed everyone for the positive.
It helped change my life and then helped me change a lot of other people's lives. And so I've just really enjoyed being able to give people other options and help them feel better and get their lives back.
Biote has made a huge impact on all of our patients, actually, both men as well as women.
I once met a patient who came to me and said that I have changed his life and that he is a lifelong believer in Biote.
With Biote, I see a spectrum of results. At the very least, people say they feel better, that they sleep better, they have more general energy. Then that spectrum can go all the way to it's been life-changing. And this is one of those few things that we can offer patients that not only makes them healthier, but they feel better as well.
Well, obviously Biote makes a huge difference in my patient's overall health. Just being able to provide bioidentical hormone replacement itself can be the change that this patient needs to get the health goals that they're looking for.
Biote has really has helped me dramatically in helping our patients, and I've never had such a happy patient population in my life. 1/3 of my patients are either fellow physicians or nurse practitioners. And when I got treated for Biote, everything got better in my life, everything.
Today I'm going to talk to you about vitamin D, specifically hormone D, combined with vitamins A and vitamin K. So vitamin A, D, and K. We have 2 ADKs, one is 5,000, one is 10,000. These fat-soluble vitamins influence several areas of the body. We live in a world where our immune systems are under attack. And so what we want to do is try to take steps to help protect our immune system. One of the ways we can do that, and one very well-researched way to do that, is to optimize our vitamin D level. But we want to combine that with both vitamin A, which also has immune support properties, and we want to combine that with specifically something called vitamin K, specifically vitamin K2. These three together absolutely influence the patient's immune system and your immune system to help you have the most robust immune system that you can in a world where, again, our immune system is constantly challenged. Another influence with ADK is it helps influence cognitive health. It influences bone health. It influences cardiometabolic health. And absolutely, as I said, influences immune health. So this is a head-to-toe intervention. So check out ADK5 and ADK10 today and see if it's the right thing for you.
I've had multiple females who've come to me with relationship issues, with not feeling like a good mother, not feeling like a good wife. With the assistance of Biote, we have really done our best to give them the energy back that they deserve, which makes them feel like a better parent, makes them less short, helps with their mental stability, helps with relationships just by virtue of increased libido, which can lead to increased intimacy, not always sexual intercourse, but intimacy, which helps the relationship, which helps the family. So this is tenfold the best product that we have to offer.
Hi, my name is Amanda, and I've been using Biote for 2 years now. After starting therapy, I immediately felt a difference within the first week or so. Definitely improved and just kept getting better after that. I have had increased energy. I have 2 little ones at home, and I'm able to keep up with them and not have a problem. And also my sleep is 100% better, and I lay down and go to bed and sleep all night long.
We all at some point reach a season of our life where we don't feel ourselves anymore. We ask the questions, how come I'm tired all the time? In women, they experience irritability, anxiousness, mood swings, night sweats, perhaps hot flashes, gaining weight, decreased sex drive, perhaps discomfort during intercourse. And those symptoms in men might show up in the form of decreased libido or sex drive, decreased performance. We gain weight in our midsection and we don't like that. We lose our muscles and we don't like that. Our strength is going down. We have reduced mental focus and concentration. We might experience anxiety or depression. We might get irritability as well. Perhaps we're having elevated blood pressure, blood sugar, cholesterol levels. Oftentimes these symptoms are rooted in hormonal imbalance. So it starts with a simple blood test. Ask your provider today how you can do that.
I will tell you there's one particular story that stands out in my mind, and that is of one of my providers in town who actually was having very difficult marital times with her husband because she was hitting menopause. She was suffering from all the ailments that, hit women with menopause. And after her first round, she texted me about 3 to 4 weeks later, and she said, "You know what, Caceres, you saved my marriage. And I thank you so much for recognizing the problem and being able to help me. I'll never leave Biote," is what she said to me.
Hi, I'm Kathy Thorpe. I'm from Kaufman, Texas, and I'm 64 years old this week. I first learned about Biote from some friends of mine in Kaufman who were on the pellets. Their energy level was high, their skin was glowing, they just felt good. So I asked them what they were doing. And so then I looked into it. So I've been on the pellets for about 2 or 3 years now. When I first started, the reason I went was because I was always so tired in the afternoons, and it was the brain fog and the low energy level. And then when you get started on them, it's like your energy level's through the roof. You feel like working out in the mornings, your skin looks good. I always tell people to go check this out because the whole reason for this is to make yourself a better person. I mean, I feel like I'm better than I was at 30 now. So instead of walking around half dead, I don't want to walk around like that. I always tell people, go look into it. Go talk to him, find out about it, and see what you can do to help yourself.
Do you have symptoms of hormone imbalance? If you're a woman and you notice that you've been more irritable than you were prior, maybe you're a little more anxious than you used to be, you feel like you have mood swings, you're developing night sweats, you're not sleeping as well as you used to, you're having hot flashes during the day or at night, you feel like your sex drive has decreased, or you have discomfort with sexual intercourse, these are all symptoms of hormone imbalance. If you're a man and you're struggling with low sex drive or low sexual performance, if you feel like you've got increased body fat, loss of muscle mass or strength, reduced mental focus, you're just not as clear mentally as you used to be, your anxiety is increased, you feel more irritable, more fatigued than you used to, if you notice your blood sugar levels have gone up or your cholesterol is getting worse, then you may be struggling with symptoms of hormone imbalance as well. So if any of these symptoms are resonating with you, I recommend that you speak to your Biote provider. Let them see if there is a way they can help treat some of these symptoms and help you be a happier and healthier you.
This is another thing I thought before coming get certified, that this was only going to be for postmenopausal women, and that we were going to help these women that were just moody and had hot flashes because they went through menopause. I soon found out that this is for people that still have functioning ovaries. For instance, one patient really depressed, weight gain, not getting out of bed, mood fluctuations. We pelleted her, just testosterone, and the changes in that patient, I really feel like saved her life. She now works out with me in the morning in the gym, 5:30 every single morning. So that would be one of the patients that stand out to me that really benefited from this.
It was my mother who at the time was 68 years old. She had had a total hysterectomy, and for 10 years she was miserable, living in this shell of a person, and traditional medicine had failed her. She had tried the pills, the creams, the patches, the shots. Nothing had worked for her, and she almost was withdrawn and was not even engaging in her own grandchildren's lives. And so I drove my parents, we took a road trip, we went to the Woodlands, Texas, we had her pelleted. And about 3 weeks later, my dad, who is a urologist, he called me and he said, "Are you sitting down?" And I was like, "What's going on, Dad?" And he said, "You know, I've never seen anything in all of my years of being a doctor and of all the years of being married to your mother that has been so life-changing. And we're gonna bring this to Houma, Louisiana."
I think one of the most unique things about Biote is that I actually have patients coming back for their 23rd, 24th, 25th pellet. And I think that that really speaks to the quality of the treatment itself. If it didn't work, then patients wouldn't be coming back to do it. Another really interesting thing is that Our practice itself, we don't have to do a whole lot of advertising and promotion. Most of our patients come referral, word of mouth. So they come in, they say, oh, well, my sister told me, my hairdresser told me, my neighbor told me, and they had great results, and they're feeling so much better. So they come in as well, and they want to be a part of that and get to feeling better too.